So it appears that we have about 20 minutes for further conversation. So I'd like to start it off with an observation that just picks up on what Kristen just said about the FDA's strategy. And this just from my own personal perspective. So I'm a policy person and have been very much, of course, intrigued by the challenge that we have of responding to what is a truly complex policy problem or set of policy problems involving the intersecting epidemics that we've been hearing about today. Obviously, at the academies, our job is to try to summarize the science and also to try to assist those that are in policymaking roles make sensible policies given imperfect information. And also, I think many of the comments that you all have made and things that we heard today show how closely related everything that both epidemics, everything that we've been addressing today, highlights the kind of the weaknesses basically in our healthcare system and the many challenges that we have in public health more generally, some of the contradictions in our drug policy. I mean, it just highlights a lot of other important challenges that we have. Having said all that, I mean, that's basically a policy observation. But what I really want to say is that in trying to think about any of these problems and any other challenges, the one thing that I spend a lot of time on and continue to do is mental health policy. And I'm chairing a commission now in Virginia. And the thing that I have learned and that you all have reinforced here in this panel is that it is absolutely indispensable at some point as you think through the policy challenges to hear the voices of those people who are most affected. And that we've been dealing with the challenges that you all have faced today, but the voices of people with mental illness and recovery and empowerment and all the things that we heard today about the importance of empowering people to take control of their own situations and so on, and hearing the experiences of people who were most affected was profoundly important, I think, in helping us make some advances in mental health policy in Virginia, for example, and we have a long way to go. So this is kind of a roundabout way of saying that one of you, I can't remember, maybe it was Penny, mentioned the public education part of this. And so the question I want to pose to you is, what is the message that is most important to convey in terms of public education? I'm seeing, I think, examples in the mental health field where I think actually significant strides have been made in that. I think as I've been listening today, it does seem to me that in rooms like this, the voices of people who have had problems with chronic pain and the 100 million people that we heard about earlier have been voiceless, I think, essentially in this in the public debate here, or the public discussion, of this problem. Obviously, they're, in the behavioral health area, I mean, it's been a continuing challenge with people with substance abuse, as well. So at this intersection of these two epidemics, I think it would be interesting to hear any observations that you all would want to make about how we can try to further the cause of actually public understanding with regard to the problems that we're talking about today.
We actually, is this on? We actually did, and we still are doing actually, a public service announcement. It's a 30-second announcement about the safe use, storage, and never sharing your opioids. And it's quite moving. It's on our webpage, and it's about, it's just family portraits, and as we're talking in those 30 seconds, somebody disappears out of of each of the portraits. And we knew if we played it in television and radio, no one would see it, so we actually been playing it in movie theaters. And we did exit surveys because we wanted to know. We have to pay for this, so we have to pay for it in little chunks and just do little pieces. But we did exit surveys. We wanted to understand what people's impact, what was the impact on people. And the highest recall anyone had ever gotten on a public service like this in a movie theater had been 73%. We got an 80% recall on this. And so we reached young kids, grandmothers, everyone who never thought about where they store their opioids, people, or any of their medications, where they take them. I mean, sharing them with other people. They didn't think about any of that. It was quite, for us, it was an awareness that people really don't know, and no one has the time. When you go to a pharmacy and pick up your medication, the pharmacist doesn't tell you all that stuff. And it's on that little tiny label that no one can read. So I think we need to do a better job. The pharmacists obviously don't have time. We actually have a graphical tool that teaches you how to take your medication. And there's the bottom two are not how to store it and dispose of it properly. So, I think there are ways to do it, to get out, but you have to go where the public is. I don't know that they're going to come to us, so we have to go to them and figure it out. We'd love to do that PSA nationally in every movie theater. We actually did it twice in Times Square as well. So we didn't do, any surveys from there. But that was one way, and it was quite an impact.
If I could add, I really commend your work, because public education is hard, and it's very expensive to scale up, and it's also very difficult to measure impact. And I think that the approach that you're taking is the way to start to lay the groundwork. But I think that's been a challenge, in that we're having this discussion during not only what the President's proclaimed as Prescription Opioid and Heroin Epidemic Awareness Week, but also National Recovery Month. And there's been a lot of events around the country, to recovery marches, recovery walks, recovery rallies. August 31st was International Overdose Awareness Day. In a couple of months, we are expecting the United States Surgeon General to put out a report on alcohol, drugs, and addiction, which is hoped to be a landmark report that will offer these opportunities on at least the broader drugs and addiction side to have these conversations around the dinner table, in the living room, in the barbershop, and all of those things, because I think some of the models were the previous Surgeon General's reports on smoking, reports on HIV/AIDS, reports on mental health. So I think that part of it is about leveraging some of these broader opportunities. Part of it is mobilizing the personal stories and testimonials. Some of you who might follow some of the policy developments know that there, alongside with movement on mental health legislation in Congress, there was passage of something called the Comprehensive Addiction and Recovery Act, which tried to establish a framework for responding to aspects of in particular, the opioid crisis, but not limited to it. As part of that organizing, there were many people in recovery who lent their voices, lent their stories, as well as parents and family members of people who had died of overdoses. So I think that we've seen the power of harnessing that to spread awareness, not just amongst policymakers, but at the local and community levels, and that's very promising. But I think that there's still a lot more work to be done.
Yeah, I think for so long in the media and otherwise, these two issues have been pitted against each other. You're either in the opioid camp or you're in the pain camp, and this is just not the case. Because I want better pain care does not mean I'm pro-opioids. Do I want opioids available when we have surgery and need them for acute issues? Yes. If you ask chronic pain patients, do you want to take opioids? Most of them are going to say no. They'd like to walk into an office and say, have the information in front of them, or what are my safe and effective options that are non-narcotic for the treatment of my pain? It's not our first choice. Oftentimes it's what we're left with because we really either fail other treatments or we just don't know what works for us. We spend many months or years trying to figure that out. There's so much similarities, and I think, recently we have seen the coming together of these groups and understanding that it's not one against the other. These epidemics are intertwined, they're related. There's some issues that are specific to pain, there's some issues that are specific to opioid abuse and overdose, but these are both silent epidemics and they're highly stigmatizing. And the public needs to understand how serious both of them are. There's no one here who could look at me or look at Jonathan or anyone up here and say, you've had an addiction problem or you have a pain problem. It's silent. And so I think there's so much opportunity. Also, you have to understand that chronic pain does not equal opioid abuse. That's another major issue. There's actually some new work that's been funded with Myra Christopher's group, with the pains group out of the National Pain Strategy, to start working on this issue and take some of the work that Penny's group from the National Pain Strategy did to push forward public awareness. But there's so much that we need to do, so much.
All right, anybody on the committee or other people out there that want to weigh in on this discussion? It's a long day. All right, well, I think there's no rule against adjourning early, I imagine. So I want to thank everyone who participated in this day. It's certainly been everything I think that the committee hoped that it would be in terms of informing us about the domains that we covered here. There will be another workshop that we will have in November. And so I hope everyone that was here for this one will be here for that one, certainly the committee members. And I want to thank all of the panelists that participated, over the course of the day for, tremendous contribution. So we are adjourned. Thank you.